Oh, in an otherwise suffocating world, I'm reaching out for arms, I'm drowning in the open-ended love we're making, girl. Exhale the past, inhale a future that lasts. Change my heart, change my mind. For the last time, wanna believe in the life I've led. I don't wanna leave another word unsaid. You know my heart will follow you in tomorrow. In tomorrow. Shared my evidence you once really cared. I'm reaching for a hand to pull me up, one open to an everlasting love. Exhale the past, inhale the future that lasts. Change my heart, change my mind. For the last time, wanna believe in the life I've led. I don't wanna leave another word unsaid. You know my heart will follow you in tomorrow. In tomorrow.
Kia ora, good afternoon and welcome again to this COVID-19 special. It's day 5 of lockdown. We're expecting to hear from the Director General of Health, Dr. Ashley Bloomfield, and COVID-19 Response Minister Chris Hipkins. He says Aucklanders should prepare for a longer lockdown. On Q&A this morning, Chris Hipkins also said with Delta, people are infecting one another within 24 hours of being exposed, which, quote, changes everything.
It does mean that all of our existing protections start to look less adequate and less robust as a result of that. So we're looking very closely at what more we can do there. But yes, it does raise some pretty big questions about what the long-term future of our plans are.
Well, political editor Jessica Much-Mackay joins us now at Parliament while we await the press conference shortly. Tēnā koe, Jess. There's been an announcement this morning on childcare for essential workers. Talk us through those details.
Yeah, so this is for people who need to go to work during level 4, so nurses, doctors, supermarket workers, for example. And what will happen is there's a list of 32 approved providers throughout the country, and parents will be able to go and book in with them, and then the carer can either go to their home to look after the child or go to the carer's home, and they will only look after that family. So it will mean that not too many bubbles are bursting, like, for instance, if you had a daycare where all the children were coming and going. So this will be a provision under level 4. It will be provided for free for those essential workers, and it means that they can still go to work and the kids are looked after. So we don't know how long we're going to be in level 4. That won't be announced until tomorrow, but this gives parents a bit of certainty. It is worth pointing out, though, that the announcement very much stressed that if there are alternatives, that parents should do that, but if there are no other options, if it's stopping essential workers from going to work, then this is an option for them. There's also another couple of things that are worth looking out for in the announcement that's set to take place in just a few minutes' time. Well, set to take place now, they're just running a few minutes late. We are set to tick over to that 1 million dose milestone for people to have had 2 vaccinations, so to be fully vaccinated in quote marks. So we are set to tick over to that 1 million mark, so keep an eye out for that. The other thing to watch out for as well is around QR scanning. We are expecting an announcement around that, and we will be hearing from Chris Hipkins and from Dr. Ashley Bloomfield in just a few minutes' time.
We'll look out for that. And a full school week is about to begin on Monday tomorrow. What about learning from home? Jess, any update on that?
Yeah, so that long-distance learning that happened last time in level 4, that will be coming back. We are expecting an announcement about that shortly. You'll remember the TVNZ On Demand programming that was provided, which just gives parents looking after kids at home a bit of help. The Minister and the Director General of Health have now moved in there at the moment, but we are expecting them to say more about at-home learning for kids. And I think for a lot of parents, especially beginning Monday tomorrow, when they may have to be juggling schoolwork and working from home as well, I think that will come as a bit of a relief for some. So do keep an eye out for that. Again, with this level 4, we just don't know how long we're going to be in this for. That decision will be made by Cabinet tomorrow. So let's take a listen to what they have to say.
Kia ora everybody, good afternoon. We're now on day 5 of our nationwide COVID-19 Alert Level 4 lockdown. So I want to start today with a very big thank you to everybody who is staying at home, staying in their bubble and contributing to our nationwide effort to once again stop the virus in its tracks. Delta is here and it is trying to move fast. People who have been at locations of interest or contacts of positive cases are spread throughout New Zealand, so we are all in this together. But we've beaten COVID-19 before, and we can do it again if we all continue to play our part. Shortly, I'll ask the Director-General to run through the latest details of COVID-19 cases in the community. And then I'm going to talk a bit more about masks and record keeping and some decisions that the Cabinet has taken there. I will work through some more of the support government's putting in place for essential workers to help relief teachers and casual staff in schools, and of course on schooling itself under Alert Level 4. But first, to start with good news, as has become my tradition, I do want to note a couple of very significant milestones in our vaccination program. After a record day for the program on Friday, where 56,843 doses were delivered, yesterday we reached a new record for a weekend day with over 50,000 doses delivered yesterday. And today we celebrate 1 million New Zealanders being fully vaccinated against COVID-19. I want to say I'm incredibly impressed with the health workforce in New Zealand. They've stepped up right across the country, particularly in Auckland, doing testing, vaccination, and supporting people through our hospitals. They continue to deliver incredible numbers that we can be proud of. I also want to acknowledge our pharmacies, our GPs, our haora providers who've been really ramping up their vaccination and testing to meet the current needs. Yesterday, 52,106 doses of the Pfizer vaccine were delivered. 36,478 of those were people entering the vaccination program for the first time. 102,243 new bookings were made yesterday. That means that 73% of New Zealanders over the age of 40 have either had at least one dose of the vaccine or are now booked in to get one. Drive-through vaccination centres are being stood up around the country as DHB's put in place their Alert Level 4 vaccination plans. They're a very good way for people to be vaccinated quickly and safely. The largest of those centres is in South Auckland. That opened this morning. It has a capacity to be able to deliver 2,000 vaccinations per day. I'm told that so far they've been doing so well they've opened up space for another 1,000 appointments. You do still need to have a booking to go to a drive-through vaccination centre, and some centres have been reserved for our essential workers who we want to provide the opportunity to be vaccinated. So go on bookmyvaccine.nz to see the availability of vaccinations nearest to you. More good news, another 382,500 doses of the Pfizer vaccine arrived in New Zealand yesterday, meaning we have over 750,000 doses on hand. So our vaccination program can scale up without having to worry about running out. So if you're 40 plus or you're in one of our other priority groups and you haven't made a booking yet, visit bookmyvaccine.nz today and make sure that you reserve your spot. A quick reminder, and a very, very important one. If you are a contact and you are self-isolating, you should not leave your house, and that includes going to be vaccinated. If you have a booking, please call the vaccine booking number or go online to bookmyvaccine.nz to change or to delay your booking. If you are a contact and you are self-isolating, please do not go to a vaccination centre. You will be able to rebook. You will also be able to rebook if you are a contact of a community case. So you should also avoid going to the supermarket or to the dairy on your way home from going and getting a COVID test. Please get someone else to do your shopping for you and to deliver that to you in a contactless way if you are at home and you are isolating. Dr. Bloomfield.
Thank you, Minister. Kia ora koutou katoa. So today I can report there are 21 new positive cases of COVID-19 in the community, taking the total number of confirmed cases in the current Auckland community outbreak to 72. All cases have been or are being safely transferred to one of our quarantine facilities. Of the 21 new cases, 20 are in Auckland, one is here in Wellington, and that Wellington case was actually first reported yesterday but has just been included in the national tally today, so there remain a total of 6 cases in Wellington. 61 of the cases are now confirmed as part of the Auckland cluster, with the remaining 11 under investigation to confirm a linkage to the outbreak, either epidemiologically or through whole genome sequencing or both, but initial assessment in most cases show an obvious link. Public health staff are obviously rapidly interviewing the new cases to establish how they were infected and any further details of their movements and possible locations of interest. That information will be released as it becomes available. In addition to the community cases, there are 3 cases to report in managed isolation today. ESR continues to run the whole genome sequencing daily on samples taken from all new cases to support our ongoing investigation. Reporting today on 17 of the cases shows that all have genomic links to the Auckland cluster, and that includes the University of Auckland student who travelled to Wellington late last week. As the genome sequences are all largely identical, there is no additional information as yet from the genome sequencing as to the direction of infection between cases. On contact tracing, the number of contacts has increased significantly, something we had expected as we identify more cases and locations of interest. As of 9 o'clock this morning, 8,667 individual contacts had been formally identified, and we expect that will continue to increase through the day as further records are fully processed. Virtually all of those contacts are considered close contacts, so are receiving regular follow-up. Of them, 4,124 have already been formally followed up and are self-isolating, and a third have already returned a test. Work is underway to contact the remaining 4,500 or so contacts, and most of these were identified yesterday as a result of recent high-exposure large events. From today, contacts who are self-isolating can choose to send their daily health and wellbeing information via an electronic survey, that is email rather than phone call daily. These people are all initially contacted by phone, and if they opt to go for email welfare checks, then they can do so, which helps free up capacity in our contact tracing teams and further speed up the process. On locations of interest, from today, new locations of interest will be published every 2 hours. If there is a significant or urgent location of interest, that will be published immediately. There are already more than 280 locations of interest identified across the motu. And we have also launched a new online search feature to make it easier for people to check for locations of interest. That is alongside the map as well. There was a small glitch in the system earlier today when the table was updated. The last updated date reset to today's date, and that is now being corrected. And from here, the last updated date will continue to update on a daily basis, but it won't change unless there is new information. As well as moving to the automated system, some locations of interest that were previously removed, that were dated from prior to the 7th of August, were republished this morning, but those have now been taken down again, and those are no longer of concern. Now, several of the new cases announced to date are linked to a church service at the Samoan Assembly of God Church in Mangere in Auckland last Sunday, the 15th of August. So anyone at this church between 9 a.m. and 3 p.m. last Sunday, the 15th of August, if you haven't already, you are asked to isolate for 14 days since that exposure on Sunday and be tested immediately or on days 5 and 12. The best thing to do is to call Healthline on 0800 358 5453 for advice on testing, and they have interpreters there if required for a range of languages. For all other New Zealanders, our advice, of course, remains the same. If you are symptomatic or have been at one of those locations of interest that newly emerges, please self-isolate in your bubble and call Healthline for advice on testing. On testing, I would like to just reiterate that advice. If you are not a contact or you're not symptomatic, then you don't need to be tested. The most important thing you can do to contribute to our overall response is to stay home. That's your best protection. Yesterday, 38,389 tests were processed across the country. So in the last week, more than 127,000 tests have been processed, equivalent to almost 3% of the New Zealand population. Clearly a huge effort, and helps to build the picture of the outbreak and give us increasing confidence about where the boundaries of it are. Testing centres in Auckland were busy again yesterday with more than 20,000 swabs taken across Tamaki Makaurau, around 9,000 in community testing centres and around 11,000 in general practice and urgent care clinics. I can only say thank you once again to all the staff there. There are 15 community centres across Auckland today, and an additional centre is being stood up at the Pukekohe Showgrounds, open from 2 to 6 p.m. today and 8:30 to 5 p.m. tomorrow. There's also continuing community testing in Coromandel, Thames and Hamilton, and there is a centre as well in Tokoroa, given the exposure there at a location of interest. All DHBs continue to provide good access to testing across the region, and there are good numbers of tests across the country. There is some unprecedented demand for testing, as you can see by those numbers, so there may be some delays in getting the results through. However, I can say that the labs are working through the backlog very quickly. For testing locations nationwide, visit the HealthPoint website, that's healthpoint.co.nz. On wastewater testing, ESR is now testing at 41 sites around the country. That covers 3.7 million New Zealanders. 13 of these sites are in Auckland and 4 are in Wellington, and further sites are also being added. There were detections reported in both Auckland and Wellington today. In Wellington, it was again a sample from Moa Point, which was taken yesterday. But samples from other sites in Wellington at Porirua, Seaview and Karori are all negative. Wastewater testing in Auckland was from samples taken on Friday, and these were positive in the eastern and western catchments of the city, but the most recent test for the North Shore from both Rosedale and Albany was negative for the first time this week. Test results from the latest sampling in Warkworth are expected in the next couple of days, and otherwise there have been no other positive detections in our wastewater testing right across the Motu. On PPE stocks, I would like to confirm we have excellent PPE stocks to respond and support this current outbreak response. These supplies are available to all providers, including primary care. We had been working very closely with primary care to make available fit testing for N95 masks, including providing fit testing machines out to primary care. Given that not all primary care providers had been able to do that, we are still making N95 masks available in this situation. We have a good system for people to be able to order the PPE they need, and that includes in aged residential care, and the feedback we are getting is that there are no problems there. Our national PPE supply chain currently holds in-country, not en route or elsewhere, 18 million N95 masks, 285 million medical masks, 18 million isolation gowns, 1.6 million face shields and 280 million nitrile gloves. There are also good volumes of hand sanitizer, disinfectant wipes and other items that are used. Under Alert Level 4, all health providers can order the PPE they need as and when. An update on the situation in our hospitals. North Shore Hospital's emergency department opened again at 4 p.m. yesterday for adults. In the meantime, paediatric children's emergency department is being diverted to Waitakere Hospital, which is the DHB's primary child healthcare site until further notice. As at 7:30 this morning, 1,191 Waitemata DHB staff had undergone testing, both on-site and at community centres, and all returned results are negative, with just 19 results still pending. There were 171 staff who were potentially in contact with the positive patient at North Shore Hospital earlier in the week, and 109 of those have returned negative swabs so far. Overall health system capacity is good across the Motu. Hospital occupancy is around 74% on average, ranging from 52% to 89%, while intensive care unit occupancy is just over 50% presently. It is very important that anybody who needs care for any reason seeks it. Do not delay. All health services, including ambulance services, primary care and hospitals, are operating safely under Alert Level 4 protocols. On the vaccination program, there was a change to the program today such that the minimum wait time after a vaccination is now 15 minutes instead of 20 minutes. This is based on advice from our COVID vaccination technical advisory group and is consistent with the approach in a number of other countries, including Australia and the United States. I myself was one of the first people to have the benefit of that slightly shorter waiting time this morning. It is the standard wait time, as I said, actually in both the UK and the US. Finally, on a separate note, as the Minister said, and I want to reiterate this, some people are going for their COVID vaccination after or while a test, or while on the way home, or while waiting for a test result. Please don't visit the pharmacy or the supermarket or the petrol station. It's very important, and the most important thing people can do if they need a test or have had a test, that they isolate until they receive the test result. Thank you, Minister.
Thank you. We're all getting used to wearing our masks when we're out of the house for essential travel or for doing our shopping. I appreciate it's not what we're used to, but we are all getting used to having our masks. I'd like to remind everyone it is mandatory to wear them when visiting Alert Level 4 businesses and services. Ministers have also decided, based on advice that we've received and we've been working through over the last few weeks, that record keeping, such as scanning with the COVID-19 Tracer app or manually signing in, will become mandatory for most events and businesses at all alert levels. It's clear that when people use the app or manually sign in rather than relying on their memory, contact tracing can happen much more quickly. And as we know, particularly in light of the situation we're facing with the Delta variant, speed means a lot. So we know from our own and from overseas examples that an outbreak of COVID-19 can be extremely difficult to trace and contain without people having a good record of where they have been and who they've come into contact with. So it will become mandatory to make a record of where you have been and the sorts of places where people gather consistently and in large numbers. That includes cafes, restaurants, bars, casinos, concerts, aged care facilities, healthcare facilities, barbers, exercise facilities, nightclubs, libraries, courts, local and central government agencies and social service providers who have a customer service counter. Places where records are already kept and people are already required to sign in, like gyms and some workplaces, won't need to adjust what they are already doing because they are already complying. Mandatory record keeping is already required at social gatherings when visiting a marae, at a wedding, a funeral, a tangihana, or a faith-based service when we are at Alert Level 2. We're now making that a requirement at all alert levels. The obligation will be on the person responsible for the place or the gathering to ensure that people scan or sign in. This will become effective 7 days after any change in alert level settings that might allow more businesses to open or gatherings to go ahead, to give people time to get their systems in place. We want to ensure that businesses and those who might be organising a gathering event have the time to get this sorted. It is an additional responsibility that we're placing on them, but we ask them to do that as quickly as they possibly can. In terms of support for essential workers, people will recall that under Alert Level 4 last year we made sure that childcare arrangements were available for essential workers who did not have other arrangements that would allow them to go to work. The government's agreed to put that scheme back in place under Alert Level 4. That will support people such as emergency service workers, border workers, and others who have to go to work at Alert Level 4 to provide quality care for their children. The Ministry of Education is working with 32 different providers across the country, and they're being made available for parents to contact from today. Just like last time, these are all licensed services that usually provide home-based early childhood education, so all of the necessary safety checks are in place. Each carer involved in the scheme will be limited to providing care for only one family. So there is limited capacity, but that means that the bubbles will stay tight and we can ensure that this doesn't become a way for the virus to spread. Families that already have in-home childcare arrangements in place won't be eligible. Those arrangements can continue as long as the carer is only dealing with one family. The government has also agreed to put in place an emergency payment scheme for relief teachers and casual support staff. and that these people are not eligible for the wage subsidy. Further information on that will be released by the Ministry of Education. I know people are also keen to know what's happening with schooling and what preparations are underway in the event that some of our young people need to continue to learn from home. We are in the process of purchasing additional devices and making sure that we have additional hard packs of materials available to send out should we need those. We already have 36,000 devices out in schools in Kura across the country, supporting year 9 to 13 students to learn from home, and we're supporting 40,000 households to stay connected to the internet where they wouldn't otherwise be able to. Online resources for teachers, parents and students are available on learningfromhome.govt.nz, and the Ki Te Ao Marama websites. They're available in both English and in Māori. The on-demand content from the home learning and Māori Reo Māori TV stations that were set up during the last lockdown continue to be available to TVNZ on demand. If we do need to extend the use of those services, we will be able to stand up those Learning from Home TV channels again and add new content if that's necessary. I want to finish by reiterating what the Prime Minister said yesterday. Remember to look out for your friends, neighbours and your family. Do they need supplies? Are they lonely? Drop them a text, give them a call. Do check up on them. Hearing a familiar voice or just listening can help people to feel connected and cared for. It's a small but important thing that we can all do. Please stay in your bubble. You just need to look across to our friends in Australia to see how people flouting the rules can drive ongoing transmission within the community. That would keep extending lockdown further, as it has done in Australia. If we all stay in our bubbles, if we all resist the urge to travel unless it's essential, however tempting it might be, then we can we can all contribute to getting through this. The vast majority of New Zealanders are doing the right thing. I want to extend a very warm thank you to all of you for that. The last thing that we want to see is post-lockdown transmission, so keep it local, wear a mask and keep your distance. When buying your groceries, wear a mask and sign in using the app or the book. And the next also just a final reminder, the next press conference will be at 3 o'clock tomorrow after Cabinet has made decisions on alert levels. Jessica.
All right, so we are going to leave the press conference there, but if you're wanting to watch the rest of the Q&A, head to our website, onenews.co.nz. Let's take a look at the main points from the press conference today. There are 21 new cases in the community, a total of 72 cases. Of the 21 new cases, 20 are from Auckland, 1 in Wellington, already around 280 locations of interest. One of those large locations of interest cases linked to the Auckland Church in Mangere on August the 15th, a service at the Assembly of God Church. They really want to make sure all those people are isolating at home. And the government is going to make it mandatory for most events and businesses to scan. Government asking businesses and organisations to prepare for that as soon as possible. Also, provision is being made for childcare for the children of essential workers. There will be 32 providers for parents to get in touch with people today to get their children looked after while they are looking after us. Reporter Vardner Barn joins us now live from one of the largest drive-through vaccination clinics near Auckland Airport just this morning. It opened just this morning. Vardner, how's it been running this morning there?
Yes, well, it's been running fairly smoothly this morning, we've been told. Just 130 people itself were vaccinated in the first hour of the site opening at 8:30 this morning. This is Auckland's first drive-through vaccination clinic, and it will be open for the duration of the week, really to make up for those appointments that were pushed back due to alert level 4 lockdown. And so that is really invitation only. You can't just drive on up and expect to get jabbed. We've seen quite a few cars here actually been diverted away because they did think that they could just drive up, but they did not have an invitation. Today, 1,000 invitations were sent out to people that had booked in for a jab at Highbrook. That centre was closed, so they were diverted here today, and they've been running so on track that they will be sending out more invitations to other Aucklanders today and also to airport staff workers. Now, from tomorrow, really the priority will be essential essential workers like those at supermarkets, taxi drivers, bus drivers, etc., for them to come and their family to get fully vaccinated.
Yes, and Mr. Hipkins saying today there was a new record. 1 million New Zealanders have been fully vaccinated. And to go and book your vaccine, if you haven't, to bookmyvaccine.co.nz. And speaking of vaccines, Dr. Bloomfield got his first jab today.
That's right. Director General of Health Ashley Bloomfield got jabbed with his first dose of the Pfizer vaccine this morning at Puputea Marae in Wellington. Now, of course, being in his mid-50s, he had to patiently wait his turn until his age category was eligible. And today he walked out with a big grin on his face, and here's what he had to say about his first jab.
Feeling great, actually. It's really nice to have got to this point. I've been talking about the vaccine for months. My age group came online just a couple of weeks ago, and so I booked my vaccine last Sunday, was able to get a slot today. Actually, last Sunday, if you were booking today, there were a lot of slots today. That's not the case now.
And the reason for that, for not being able to find a slot, is that demand has increased. Over 70% of Kiwis are either booked in or vaccinated. So clearly there is a huge level of interest there, which is exactly what officials want to see, Wendy.
They do indeed. All right, thank you for that, Vardner Barn, live from a drive-through testing centre in South Auckland. Well, thank you for watching this One News special. I'll be back with more COVID-19 developments at 6 o'clock. Have a good afternoon.